When Joe Quinn was born a year ago, his mother had no idea that standard genetic blood tests in the hospital would thrust her and her child into the center of a federal lawsuit.
Didn't even realize that the heel stick and the blood draw had occurred in the hospital.
Texas state law requires that blood be taken from every baby born in Texas to screen for a variety of diseases. This screening, which has been around since the 1960s and is used in all 50 states, has important benefits such as catching somewhere between 4,000 and 5,000 infants with genetic disorders, including some that would have led to disability or even death if not caught with a simple heel prick hours after birth. But that knowledge is now coming with a price in more than 50 states.
I agree with the newborn testing. I mean, I'm glad to know that my son doesn't have any kind of metabolic disorder. I just couldn't believe it.
The state, without her knowledge or consent, was keeping her son's leftover blood samples.
It made me really mad that nobody asked me whether they could keep my son's DNA.
In fact, the state didn't ask any of the parents whose children were born between 2002 and 2009 for permission to bank the millions of blood spots collected under the newborn screening program. The blood spots are valuable for use in scientific research. Research Andrea had no idea her son was participating in.
The government still has to ask. They can't just take it. And everyone has the right to make that decision for themselves.
Joe Quinn's family won the court case and had a new law enacted which says that identifying information must not be released without patient consent, but has this loophole. Privacy experts say the loophole still allows states like Texas to collect the genetic information of newborns even if parents opt out of the program.
It's not secret. It means that they can share it and use it for research, for public health. There are many laws that allow the use of samples like newborn blood samples for public health uses and screening and so forth. So, no, you're not protected.
Even though most parents want informed consent to store and use their children's samples, many states do not have clearly articulated policies in this area, and most do not effectively communicate these policies to parents. Newborn screening is one of the few forms of genetic testing which almost everyone is exposed. To ensure that parental desire for informed consent is balanced against facilitation of beneficial screening and research, there must be a greater discussion and debate about newborn screening sample storage and use practices that involves all segments of the public. For Andrea and her family, the answer was clear.
For me and my family, no, you can't have our DNA.